Hi guys, Uncle Shredder here again. Now today's video is answering questions I get asked quite a lot, and it's to do with how to use an insulin pen to administer testosterone. So if you're a guy over 40, you're probably a bit low in testosterone. If you're a guy over 50, you're almost certainly low in testosterone. So off you go to your doctors or get a private blood test done and ascertain your testosterone levels. The scale in the UK is somewhere between 8 low, 27.5 is the top end of the scale. So get your levels checked, and then you can think about testosterone replacement therapy. Now then, disclaimer straight out there, straight away. I'm not saying that you should or should not be injecting any sort of steroidal compound, and testosterone is a steroidal compound, but by the same respect, so is vitamin D. So make your own mind up about that. I'm not telling anybody to do anything. This video is about if you wanted the information on how you could use an insulin pen, obviously giving your doctor's prescription and recommendation that you should do this. Now, why would you do this without your doctor's recommendation? Well, first of all, I definitely would say get your testosterone checked. No point trying to fix something that's not broken. Secondly, the NHS, I believe, if they address this problem for every guy over 40 or over 50, it would go bust within a month. So this is what I would say is more about quality of life rather than life or death situation. Can you live without testosterone? Absolutely. Of course you can. Absolutely. Do you feel great? No. Not at all. This is like quality of life. It's not life and death. Right, so on with it. So, I'm going to show you what you would need in order. So first of all, obviously you would need your testosterone, which is an oil-based compound, usually in either a single use or a multi-use vial. Okay, so you are going to need two things to get that oil out of that bottle, and that's one of these, which is a 2.5 ml barrel. I'll take it out of the packet to show you what it looks like, naked as it were. And there you go. Got a little scale on the side, shows you how many mil or percentages over a mil that you're drawing out of your bottle. Secondly then, you're going to need one of these, which is a green needle. Okay, now that one is a green needle and it is 21 gauge. So I'll get that out of the packet and show you that. Comes with a little safety cap on the end. So that goes onto that. Right, the next thing you need is one of these, which is an alcohol swab. Now, the top of your bottle, you're going to be putting that needle, if it's a multi-vial bottle, through a rubber bung. So you want that rubber bung to be clean. So you wipe the top of the bottle. When you've wiped the top of the bottle, then you're ready to take your little safety cap off. There it is, nice and sharp. Now at this point, you keep that needle away from everything. I mean, don't even breathe on it. I mean, really keep it isolated from snagging, touching anything. As soon as it touches anything, that's bacteria onto there. And that is not a good idea. So keep it away from everything. Don't let it touch a thing, all right? So let's imagine you've got your multi-vial bottle here, and then you're going to put that needle through the rubber bung. It's a good idea before you put it in to draw this back, okay? So that when you put that needle through into your bottle, through that rubber bung, needle goes up, it's inside the bottle, inside the liquid. Then what you do is you push that up, and it pushes that air into the bottle and creates an overpressure. And that makes it easier to draw out, okay? So then you're going to hold the bottle, draw down on your plunger till you get to where you need to be. Now, when you've got to where you need to be, so for TRT dosages, typically, most testosterone enanthate compounds, concentrations being somewhere between 250 and 300 milligrams per mil, you're literally going to be somewhere up there. Really, really tiny amount. It's not much. This is for TRT, Testosterone Replacement Therapy dosages, okay? So you've not got much in there. Tiny, tiny little amount. Then you need your insulin pen, commonly known as a slim pin for obvious reasons. And that is a 27 gauge. So thinner again. Thinner needle. Now then, you've got oil in there, and you've got to get it from there into there. So what you do is pull the back off. Pop, pop it goes, there it goes, look. That's come off there. And you keep this out of the way of everything, and you backfill your pin. So this then, the oil in there, gets put into there, push your plunger, in the oil goes, and that's it, you're done. Don't need that anymore, that goes in your disposable sharps bin. Keep it safe, keep it clean. Then this goes back into there, pop it back in, and then put it upside down. Take the lid off, and you will usually have a bit of oil sticking about right about the top somewhere. So you give it a bit of a flick, and let it all run down, and then you'll be left with a tiny bit of oil on top of that plunger. Push the plunger all the way up. Now, because this is a much finer scale and a thinner needle, you're going to be 2.5 in there would equate to 2.5 mil on there, which would be that. Alright? So the next thing you're going to do is then you're going to need to get that into your body, into a muscle. So you would put the cap back on to keep everything clean and prepare a site for it to go into, which is where you use a new, clean alcohol swab. Wipe the area. You can use your delts, you could use the long head of your tricep, you could use the outside of your thigh. Again, guys, don't do this without some consultation and really knowing what you're doing. So, realistically, your doctor should be showing you how to do this properly. Don't just go jumping in doing this, unless you do know what you're doing. Okay, so you've wiped the site with the alcoholic swab, and then comes your pin. What I would say about this pin is, that needle is tiny. Really short needle. Now you need this through your subcutaneous fat, the bit of fat you hold underneath your skin, and you need it getting into a muscle. So you need to find a muscle that's not got a lot of body fat on it. You could do your biceps, they're usually lean on everybody, but whichever site you use anyway, it's got to be a lean site, because that has got to get through the fat and into the muscle, okay? When you do push it into your muscle, it's a good idea to push it and so that it sort of indents, causes a little dimple on your skin, and that just gets it another couple of mil further through the subcutaneous layer. And then hold it nice and steady without the back end waving about like a flag, because you don't want that sharp front end rolling around like that, because that's going to cut inside your body. And then just hold it nice and steady. Slowly push your plunger. Pull it out at exactly the same level that you put it in. Give yourself another white rain alcoholic swab. And that's it, you're done. Dispose of that responsibly. So that's it, guys. That's how we actually do a TRT dose of testosterone if you was looking for that kind of thing. For you guys doing big compounds of performance enhancing drugs, micro dosing every day with one of them really levels off things. So instead of putting a big dose of whatever you're going to put in twice a week, you put a small dose in 7 days a week. And that creates a much better blood and hormone blood level. Okay, guys, a bit of a controversial one there, but hey, there you go. Testosterone replacement therapy, it is a big deal. I will be making another video on my views on TRT, why we should think about doing it. Okay, that's me. Over and out, Uncle Shredder out for the next one. For this one, hope to see you on the next one.